A warning from a medical expert that a sore throat with no sign of going away could be an early indication of cancer. TVJ Shamela Pullen tells us more in this evening's health report.
Sore throats can be annoying. Normally, with a sore throat, persons would have difficulty swallowing, have loss of appetite, experience weight loss, and restlessness.
It's when you have pain on swallowing. And usually some people might say, it feels like they're swallowing broken glass. It's that kind of severity in terms of the pain, but something that the patient will feel when they swallow. And then they may have the other associated symptoms like a fever, and they may have pain in the air. They may also have some nasal symptoms like stuffiness and drainage of mucus.
Ear, nose, and throat surgeon Dr. Merton Smith says usually a sore throat can be due to a virus commonly caused by the flu. But unfortunately, a sore throat can be a manifestation of something more serious than that.
For example, they could have a cancer in the tonsil, a cancer at the back of the tongue, a cancer at the top part of the voice box, which presents as a sore throat. And these are the ones that we have to make sure that we pick up and not just manage as a regular sore throat. It's usually seen in older patients, middle-aged to elderly, especially men who are smokers and drink a lot of alcohol. A more common demographic now that has been getting increasingly prevalent, of course, are the patients who have the human papillomavirus infecting the throat as well.
The ENT surgeon says a sore throat lasting for a day can be treated with pain reliever. The individual is also advised to stay hydrated. However, if the sore throat does not go away within a day and it is interfering with the individual's ability to eat and drink, that person needs to seek medical attention.
And those persons now require a detailed examination usually by an ENT doctor, where we use cameras to look in the throat at lower levels, and we make a diagnosis, and then we manage. If it's a tumor, we'd want to biopsy it, and then we treat with either surgery or chemotherapy and radiation.
With your health report, I'm Shamela Pullen wishing you good health.